Ketamine has hit news headlines repeatedly over the past year, first as a primary biological cause of Matthew Perry's untimely death. It begs the question of what ketamine is. Is it a therapeutic medication that helps people overcome depression, or is it a lethal drug that should at all costs be avoided? We're going to talk about all of those questions today to help you become a more informed consumer if you are contemplating using ketamine for any therapeutic purpose. Hello and welcome to the Dr. Suzette Glasner Podcast. Thank you to those of you who have been liking my videos and subscribing to my YouTube channel. If you haven't done so already, please do. It does help me to continue to bring mental health and addiction science-related content, especially as it relates to news headlines. And speaking of news headlines, ketamine has hit news headlines repeatedly over the past year, first as a primary biological cause of Matthew Perry's untimely death, which I spoke about in my recent podcast episode, and even more recently as the focus of an underground criminal network that allegedly led him to accidentally overdose. As many of you know, 5 individuals have been arrested and charged in conjunction with Matthew Perry's death, 2 of whom have been recently sentenced, and both of whom are physicians who were charged with illegal distribution of ketamine. So this brings about a lot of questions about ketamine, especially given that Matthew Perry was reportedly undergoing treatment with ketamine for anxiety and depression. At least that was his initial involvement with ketamine, to which we are aware, and then it evolved into something else and something very harmful. This is somewhat confusing for folks in that it begs the question of what ketamine is. Is it a therapeutic medication that helps people overcome depression, or is it a lethal drug that should at all costs be avoided? Is it an addictive drug? We're going to talk about all of those questions today. So ketamine is a chemical compound that has been primarily used as an anesthetic, both for humans and in veterinary practice. It was developed in the 1960s as a less toxic alternative to PCP, which was also developed as an anesthetic. So what does it do? At high doses, ketamine can lead to euphoria, or like a really good pleasure feeling, and that can be accompanied by feelings of intense detachment, or what we call dissociation, from a person's physical environment. So people report sort of a distorted sense of time, space, and balance, as though they're detached from their body, sort of an out-of-body experience. Often that occurs in a dreamlike state, and reality appears far off in the distance. This has been described by some people as the K-hole, and stemming from these kind of psychologically rewarding effects, ketamine has actually grown in popularity as a party drug globally. And only in certain parts of the world is it really being viewed as an escalating problem in that sense. Asia in particular is one area where we're seeing increasing use of this as a party drug. And there are, of course, some risks associated with high doses of ketamine. So one of those is feeling confused and unable to speak, almost like you're paralyzed. And those are experiences that Matthew Perry reportedly endured during his last month of life when he was using ketamine repeatedly at home. And as he developed tolerance, which is the need to take more and more of a substance in order to achieve the same effect, along with cravings for ketamine in between uses, the negative experiences like this sort of paralyzed, confused, immobilized feeling, however frightening, they weren't enough to stop him from continuing to use ketamine. And we know that that is a hallmark of addiction and addictive behavior, is that even though a person may experience some very negative and at times very scary consequences of their use, they continue to use a substance anyway. So that was a flag that Matthew Perry's relationship with ketamine had extended far beyond the therapeutic relationship he was seeking initially in order to experience some relief from depression and other mental health symptoms that he was experiencing. So let's talk a little bit about the addiction potential of ketamine, because there is some mixed data on this, some of which is showing that it has relatively low addiction potential across the board, except for certain people with certain types of histories and conditions. Let's just start by talking about the increased prevalence of ketamine use among nightclub and dance festival attendees. So in a New York City sample, that rate jumped from close to 6% in 2016 to over 15%. So it more than doubled in a New York City sample. So this isn't just happening in Asia, even though it's highly prevalent in Asia. And while ketamine does have this sort of wide safety margin and is generally considered a less risky drug than various other types of substances that are commonly used recreationally, both acute and chronic effects of using ketamine have been observed that really vary depending on the dosage of ketamine that a person is taking, how frequently they're taking it, and importantly, the use of ketamine in combination with other substances, which appears to be particularly risky and hazardous. So, according to a recent systematic review, the most serious adverse effects that have been observed, which include cognitive impairment, so impacting a person's ability to think rationally, there are urinary symptoms such as urinary cystitis or other urinary tract issues, and there are also some upper gastrointestinal or GI problems that have been reported that are referred to loosely as K cramps. Those were associated with chronic and heavy use of ketamine, and several studies showed this sort of dose-effect relationship between how long they have been using ketamine and how severe those adverse effects were. So how much and how often you're using it really matters here. And then the point around ketamine and what we refer to as polydrug use, when someone's using ketamine in combination with other substances, that is a very strong link with adverse effects. So for example, there was one study of people who attended nightclubs and festivals who were using ketamine, and nearly 20% of those who used ketamine in the past year had experienced a harmful or very unpleasant effect. And over half of those instances involved the use of other substances. A quarter of them were using alcohol, nearly 20% of them were using cocaine, and nearly 20% of them were using ketamine in combination with ecstasy. So mixing ketamine with other substances is very risky and it tends to lead to negative outcomes. Why is ketamine addictive? So there's a few reasons. The primary one is that it's absorbed quite rapidly in the bloodstream. So that means that the pleasurable effects of ketamine occur very rapidly after it's taken, and yet its effects don't last very long. We're talking a maximum of a few hours. So when you have a drug that can lead you to feel intensely good and then its effects wear off very quickly, the desire to take more is really potentiated. And that increases misuse of this type of substance and the tendency to binge on a substance of this kind. So people who take it in party environments have been surveyed in research, and they say that using it repeatedly is difficult to stop because it becomes a tool to engage in social interaction. It's also worth noting that it's less expensive than other substances like cocaine, which may be contributing to its growing popularity in certain parts of the world. Now, something that's important to know is that the immediacy of a drug's effects on the brain elevates the likelihood of addiction. And so one important aspect of drug taking that influences how immediately it reaches the brain is the way that you take a drug. So do you take it orally, by mouth? Do you snort it? Do you inject it? So it's more addictive if you snort it than if you take it orally because it reaches your bloodstream and your brain faster. It's most addictive if you inject it versus any other way that you could take a drug. And we tend to see the poorest outcomes from treatment among people who were taking a drug by injection or intravenously because they're just a lot more addicted to it. And that makes it all that much more difficult to overcome the addiction. Not impossible, it's just harder for them. And so Matthew Perry was taking ketamine intravenously, and that means that he would have formed a pretty severe addiction to it if he was doing that repeatedly, which we know that he was. And so when you take that together, the effects of ketamine on the brain, the accessibility and the affordability, those together have given rise to what is known as ketamine use disorder. And that is an illness that appears to have prevalence rates that are on par with addictions to other substances such as stimulants, which would include cocaine. And Matthew Perry joined a growing cohort of Americans for whom ketamine treatment was being initially used as a therapeutic therapy for depression. We do know that there is compelling evidence from clinical trials and clinical research studies suggesting that taking ketamine can really be transformative for people who have what we refer to as treatment-resistant depression and or depression with suicidal thoughts. And we know from studies that around 30% of people who receive medication treatment for depression via oral antidepressants for a depressive illness, around 30% of them experience what we refer to as treatment-resistant depression. And what that means is that they fail to respond to at least 2 trials of antidepressant medication treatment. And that's where an alternative treatment such as ketamine could come in and really could be life-changing and or life-saving. To make a decision like that, however, you do need to be a very informed consumer about what kind of ketamine you're taking and what the risks and benefits are. And that's really what I want to impart on you today, is not that no one should take ketamine, but that for individuals who do opt to take this form of treatment, that you go into it super informed, because there are people who are prescribing it in the way that it's intended according to the research literature and what it has shown it to be effective for. And then there are others that are prescribing it in ways that it has not been studied or established to be safe. And that's where you get into sort of a risk zone. So I want to talk about the FDA approved formulation of ketamine. So the ketamine derivative known as S-ketamine with the brand name Spravato was FDA approved as a nasal spray for the treatment of treatment-resistant depression. And because there are risks of sedation, dissociation when a person is taking this formulation of ketamine called Spravato, patients are required to remain under direct supervision by a medical professional for 2 or more hours after being dosed with this nasal spray. And what perhaps is a less known fact about ketamine is that it's actually made up of 2 molecules that are mirror images of each other. These molecules are known as S-ketamine and R-ketamine. And while the FDA-approved medicine for depression, S-ketamine, contains one of these 2 molecules, which is the one with the letter S, the original drug from which it's derived, which is known more broadly as ketamine, mixes those 2 molecules, S-ketamine and R-ketamine, is not approved for the treatment of any psychiatric conditions. So this is important because with the proliferation of ketamine clinics, many healthcare practitioners have departed from the use of S-ketamine, which is the FDA-approved medication, because it's subject to these very rigorous regulatory requirements to mitigate the safety risks. So many people in this industry and in this field have reverted to prescribing the drug that's simply known as ketamine instead. So ketamine offers a loophole that makes managing patients much easier because it's not subject to these same types of regulatory requirements for mitigating safety. Doctors can prescribe it without being anchored to hours of required observation after dosing, and there are much fewer restrictions on pharmacies' capabilities to distribute it. So for many of these reasons, the practice of what we call off-label use of ketamine is rapidly increasing, meaning that some doctors prescribe it for conditions that it's not FDA approved for, and it can be administered in ways that have not been well studied for the treatment of psychiatric conditions. So it can be administered by injection, it can be administered without medical supervision, and the dosages can vary. Whereas if somebody's using the nasal spray of S-ketamine, which was rigorously studied and FDA approved for the treatment of treatment-resistant depression, it has to be prescribed in a certain way with a certain dosage and a certain observation requirement for safety. And all of those were safety guardrails that were put in place to minimize the number of adverse events that would follow use of this medication and really to optimize its safety. I want to say that off-label prescribing is not uncommon in medicine. So you've probably experienced taking a medication for an indication that it was not FDA approved for. Some people will take an antidepressant medication called trazodone to help them sleep because at low doses it has these sedating effects, but it was originally approved for the treatment of depression, not for insomnia per se. So this isn't an uncommon practice in medicine, and it's not a bad practice in medicine to prescribe something off-label, but the downside to it is that in some cases we know very little from research to inform safe prescribing practices that are off-label. So with ketamine in particular, we have very little research to inform safe ketamine prescribing for the varied populations who are drawn to ketamine therapy. For Matthew Perry, there were sadly multiple indications of risk for complications ranging from addiction to death. So talking about the real risks that are associated with any version of ketamine, ketamine is an anesthetic. If you get enough of it, you will become completely sedated, and that's always a risk that's associated with it. But it has other physiologic effects on heart rate and blood pressure that can be pronounced. And for most people, that's not an issue. But for some people who have an elevated risk of cardiovascular events, such as stroke or heart attack, there can be very serious consequences. So if somebody has coronary artery disease or has an aneurysm, ketamine could be lethal to them on the spot. There are also psychological risks. So when you're taking any form of ketamine, it has significant effects on cognition or one's ability to think. And there are quite a few studies that show that your ability to make rational decisions is completely disrupted when you take ketamine. And usually that period of time is an hour and a half to maybe 2 hours. And that's the reason for the 2 hours of observation, is to keep a person safe. It can also dramatically alter perception. So people can hear things differently, see things differently, feel things differently. And that can be very frightening to some people and cause them to act differently than they otherwise would. And again, these are the main reasons why the FDA declared that this substance is only safe in a healthcare facility under supervision. So now let's talk a little bit about the risks and benefits of ketamine therapy for mental health. So what ketamine experts say is that while S-ketamine has some great advantages over more widely studied and commonly used antidepressants, especially the fast results, there are many unknowns and potential risks that remain. So in terms of fast results, people do observe improvements in mood in as little as 4 hours compared to weeks of waiting for mainstream antidepressant medications to work. But there are limitations. So first of all, our knowledge is limited about the ideal dosing frequency and how long you need to be in ketamine therapy to provide long-term benefits. We do have some studies to inform that, but there's not a ton known. Second, the addiction potential of ketamine is pretty well documented, and it's heightened among people who have a history of addiction. Third, ketamine can trigger schizophrenia-like symptoms in some people. So visual hallucinations, delusional thoughts, dissociating, cognitive impairment. And so it has to really be used with caution among people who are at risk of psychosis or who have an active psychotic disorder. And then fourth, because it's an anesthetic, there are health risks that are associated with using ketamine in any form. So its effects on heart rate and blood pressure can be serious or even lethal for individuals who are at risk of cardiovascular complications. And in Matthew Perry's case, coronary artery disease was listed as a contributing factor to his death, suggesting that he may have been someone for whom ketamine posed extreme health risks. And then finally, as with many novel therapeutic treatments that give new hope to people who have suffered from psychiatric symptoms and have not been successful in finding relief from more traditional treatments, it's important to avoid letting the hype about ketamine overtake your careful consideration of what we have learned from science to date and what are the safest ways to be taking a medication like ketamine. So ketamine is not a panacea on its own. I would think of it as one component of a comprehensive plan of care that would involve ideally close monitoring by a trained professional in mental health care and follow-up. We've seen this hype not only with ketamine, but with other novel treatments like psychedelics and cannabis. It leads a lot of people to tend to pursue treatment approaches to address a variety of problems for which the scientific evidence is lacking or very minimal. In some situations, ketamine and S-ketamine are contraindicated or their safety has not really been well established. And for those reasons, considering other treatments is appropriate. We do have a number of alternative therapies for depression and anxiety that have evidence behind them. And then there's situations where the safety of ketamine and S-ketamine has not been well studied or established. So the first is those with psychosis or who are vulnerable to psychosis. And then the second is in people with substance use history or current addiction. So especially those with severe addictions. There is some limited data that shows that in individuals with a history of addiction, ketamine can be effective in the treatment of depression. But there is very little data to inform our understanding of the safety and effectiveness of ketamine and S-ketamine in people with severe addictions. Matthew Perry was someone with a very severe addiction history and someone for whom the effectiveness and safety of ketamine would have been considered completely unknown and certainly more risky than not to use it with somebody with his severe addiction history. So the third is ask ask questions. If you are getting esketamine or what we call racemic ketamine, which is that original formulation of ketamine that combines the S and R molecules, ask if it's being used off-label. And if it's being used off-label, then ask what the evidence is for the way that the practitioner is using it for the condition that you're seeking treatment for. Also ask about the risks and benefits. I wouldn't use ketamine in a setting where there isn't close psychiatric follow-up or mental health monitoring. Know that while it's being studied for other conditions besides depression, like anxiety, post-traumatic stress disorder, and even for addiction, it is not FDA approved for any other mental health condition aside from treatment-resistant depression at this time. And that is something that is important for you to consider as you're making decisions that impact your safety and your well-being going forward. So I hope that you learned something valuable today, and I look forward to seeing you next time.